Hello everyone, welcome to the Gregory Medicus. Today we are going to discuss an important topic from surgery, that is cellulitis. So, what is cellulitis? What is the definition of it? It is a spreading non-suppurative inflammation of subcutaneous tissue. Okay, so what are the organisms causing it? We'll see. The most common organism causing it is beta hemolytic streptococcus. Okay. Other organisms are Staphylococcus aureus or Clostridium perfringens. Sometimes high virulent organisms like Streptococcus pyogenes can also cause cellulitis. What is the pathophysiology? So why we are not everyone is not getting cellulitis? We will see what is the reason behind it. What is the pathophysiology? First, the risk factor. The risk factor. The risk factor for the pathomechanism of the cellulitis is first diabetes or any immunocompromised state. Immunocompromised state. This causes the risk factor. What will lead to? What is the predisposing factor? Is injuries. Either may be minor injury or major injuries. Minor or major injuries, scratches, or animal bites like snake bite, snake bite, scorpion bites. So it it acts as a entry for portal entry for organisms like streptococcus or staphylococcus, any other organisms. These organisms will enter into the subcutaneous tissue and causes inflammation. But along with that, these organisms can produce enzymes such as streptokinase or hyaluronidase. This hyaluronidase or streptokinase will break the breaching layer of the tissues surrounding it, break the layers surrounding it, and spreads the inflammation without any boundaries. Constantly, it will spread total subcutaneous layers. Okay, so what are the most common sites involved? Most commonly, it is affecting subcutaneous layer. So, subcutaneous layer mostly consists of areolar tissue, loose connective tissue. This loose connective tissue, wherever it is, wherever you see, there is a chance of cellulitis. The most common sites involved are lower limbs, face, mostly commonly orbits, scrotum. So, next coming to the clinical features. What are the clinical features of cellulitis? It is an inflammation, common sense. It is an inflammation. So there will be a signs of inflammation. We will see redness and itching or itching of the that layer, and there will be a swelling. Will be a swelling, itching and swelling. Sometimes the infective organisms produces exotoxins. These exotoxins causes the fever, pain, or sepsis. So on examination, what you will see, there is a inflammatory signs, that is redness and swelling. So due to the whenever there is a swelling, there will be a stretching of skin will be there. This stretching of skin will looks shiny skin, shiny skin appearance. You can see. Okay. If you are, what will happen if you won't eat that cause? So if you if you are not treating cellulitis, it can lead to cellulitis is non-suppurative. So it can cause suppuration. Suppuration can lead to abscess formation, or it can cause sloughing of the skin, gangrene. So next is the compli- complications. So before going to the complications, we see the images of the cellulitis. These are the images of the cellulitis taken from standard book Bailey and Lowe. And this is the streptococcal cellulitis. This is the streptococcal cellulitis, and this is the staphylococcal cellulitis involving the orbits. This is involving leg due to the following a minor puncture of the wound. This is staphylococcal cellulitis of the face and the orbit. We can see the swelling around the face and the orbit. Okay. Next, coming to the complications. What are the complications? You will see in between complications. Complications are abscess formation. We already discussed due to suppuration. So what we have to do? Drain the abscess. Next, we already discussed highly invasive organisms or highly virulent organisms. Highly invasive organisms can cause necrosis of fascia, fascia and the skin, causing a condition called necrotizing fasciitis. What is the treatment for this? This is debridement of the tissue. That means removal of tissue and grafting, skin grafting. Exotoxins, we already discussed, sepsis it will cause. If it is some organisms like streptococcus or staphylococcus, it can cause toxic shock syndrome. Okay, remember this toxic shock syndrome. Next is cellulitis can also cause ketoacidosis. Ketoacidosis dosis in diabetes mellitus patients. Next, coming to the last part, important part, treatment. What you will treat? First, we have to reduce the edema. Edema can be reduced by elevating limbs and taking bed rest, or we can do the dressing with glycerin magnesium sulfate. This glycerin magnesium sulfate will act as an osmotic agent and it will attract the water out and it reduces the edema. Okay. Next, we have to treat the cause. If it is a diabetes, we have to control the blood sugar levels. Blood sugar levels. If possible, if it is not controlling, we should shift them to from oral glucose drugs to the insulin. Okay. Next, for the snake bite, if the reason is snake bite, we have to ultimately give antivenom to the patients. Next, for Staphylococcus aureus infection, Staphylococcus or Streptococcus, whatever it is, what we will use? Yes, you are correct. It is penicillins. So we will use intramuscular or IV crystalline penicillin. We will use. What is the schedule? Every sixth hourly, we should give sixth hourly. Sixth hourly means daily. Yes, four times. Four times per day for 5 to 7 days. If not, we can treat them with cephalosporins. That's it. If you like it. Thank you.